Welcome to this training module on managing sensory overload. As a certified nursing assistant, you are on the front lines of patient care, and your ability to understand the unique needs of your residents is vital to their well-being. Today, we are focusing on a critical aspect of caring for individuals with autism: sensory processing. Many individuals with autism experience what we call heightened sensitivity to sensory input. To understand this, imagine the world around you: the hum of the air conditioner, the flicker of a light bulb, or the texture of your scrub uniform. For most of us, the brain filters these things out. However, for a person with autism, these everyday stimuli may not be filtered. Instead, they can feel overwhelming, intrusive, or even physically painful. Sensory input includes everything we take in through our senses: noise, lighting, touch, smells, and even the textures of objects or clothing. When these inputs become too much for the brain to process, it leads to sensory overload. As a CNA, you play an important role in recognizing these sensory triggers. By being observant and proactive, you can help create a calm, supportive environment that promotes safety and comfort for your patients. The first step in providing high-quality care is identification. We must understand what specifically might be causing distress. Every patient is different, but there are several common triggers found in healthcare settings that we should always be mindful of. First, consider the auditory environment. Loud voices in the hallway, the sudden piercing sound of a call light or bed alarm, or even the constant white noise of a television in the background can be distressing. Next, look at the lighting. Many healthcare facilities use bright or fluorescent lighting. For some patients, the high intensity or the subtle flicker of these lights can be a major source of agitation. We must also consider olfactory triggers. Strong smells from cleaning products, floor waxes, or even scented lotions can be overpowering. Remember, a scent that seems clean or fresh might be perceived as a sharp, chemical assault to a patient with sensory sensitivities. Textures are another factor. The feel of certain clothing fabrics, the starchiness of hospital linens, or the cold, hard texture of medical equipment, like a blood pressure cuff or a stethoscope, can cause an immediate negative reaction. Finally, one of the most significant triggers is unexpected physical touch. If a patient isn't prepared for contact, even a gentle hand on the shoulder can feel like a shock to their system. It is essential to remember this rule of thumb: a stimulus that seems minor to you may feel intense to the patient. Just because you aren't bothered by the sound of the laundry cart rolling by doesn't mean it isn't causing your patient significant stress. Here is a CNA practice tip to keep in mind: observe patterns. If you notice a patient becomes distressed every Tuesday morning, look for what's happening at that time. Is the floor buffer running? Is the hallway busier than usual? If a patient reacts poorly during a specific activity, like a bed bath, consider the sensory causes. Is the water too loud? Is the washcloth too rough? Always report these observed patterns to your supervising nurse so they can be integrated into the care plan. Once we recognize the triggers, our goal is to modify the environment to prevent overload before it starts. Creating a calm care environment is a foundational skill for a CNA. Whenever possible, take steps to lower background noise. This might mean closing the door to the patient's room, turning off the TV during care, or asking coworkers to lower their voices nearby. When you speak, use a calm, steady tone. Avoid high-pitched or loud exclamations. Your voice serves as an anchor for the patient. If you remain calm and rhythmic in your speech, it helps the patient feel secure. If it is safe to do so, reduce bright lighting. Pull the curtains or use a smaller bedside lamp rather than the overhead fluorescent lights. Always prioritize safety. Make sure you can see well enough to perform your tasks, but aim for the lowest comfortable light level. Efficiency is also a form of sensory management. Prepare your supplies before you enter the room or begin care. Fumbling with plastic packaging, leaving and re-entering the room, or moving equipment around creates unnecessary movement and noise. By being prepared, you keep the environment stable. Consistency and predictability are your best tools to reduce anxiety. Patients with autism often thrive when they know exactly what to expect. Before starting any care task, whether it's taking a temperature or assisting with a meal, always explain what you are going to do. Sudden actions can increase distress because they catch the patient off guard. By narrating your actions, you remove the element of surprise. Physical touch is a necessary part of nursing care, but for a patient with sensory processing issues, it must be handled with extreme care and respect. Some patients may not tolerate unexpected touch at all. First, always introduce yourself clearly as you enter the room. This identifies you as a safe, known person. Second, explain exactly where and how you will be touching the patient. For example, say, "I am going to place this cuff on your left arm now." Third, ask for permission when appropriate. Even if the task is mandatory, asking "Is it okay if I move your arm?" gives the patient a sense of agency and prepares them for the contact. Fourth, always approach from the front. Never approach a patient from behind or from their peripheral vision where they might be startled. You want the patient to see you coming so their brain has time to process your presence. Pay close attention to body language. If a patient pulls away, winces, or becomes tense, you must pause. Do not push through the resistance. Reassess the situation. Perhaps they need a moment to breathe, or perhaps the way you are touching them is painful. Never force physical contact unless it is absolutely required for immediate safety. Always follow your facility's specific policies and the patient's individual care plan regarding physical interventions. In many cases, the patient's care plan will include specific tools to help them manage their sensory environment. As a CNA, you should be familiar with these items and ensure the patient has access to them. If included in the care plan, patients may benefit from noise-reducing headphones to block out the sounds of a busy unit. Weighted blankets can provide deep pressure input that is very grounding and calming for some individuals. Fidget items such as stress balls, textured squares, or tactile toys can give the patient a way to redirect their energy and focus. Additionally, ensure the patient has access to a designated quiet area if they begin to feel overwhelmed. You may also observe the patient engaging in self-soothing behaviors. This might include rocking back and forth, humming, or tightly holding a specific object. In the clinical world, these are sometimes called stimmying. If the behavior is safe and not causing harm to the patient or others, allow it. These actions are often the patient's way of regulating their own sensory input and staying calm. Despite our best efforts, sensory overload can still happen. It is your responsibility to monitor the patient for early signs of distress so you can intervene before a full crisis occurs. Keep a close watch for these early warning signs. The patient may cover their ears or eyes to physically block out the environment. You might see an increase in the intensity of pacing or rocking. Watch for emotional shifts such as sudden agitation or, conversely, complete withdrawal, where the patient stops responding to you entirely. Physical signs like rapid breathing or verbal expressions of distress, such as crying out or repeating phrases, are clear indicators that the environment has become too much for them to handle. If you observe these signs, take action immediately. First, reduce stimulation. Turn off the lights, shut the door, and stop whatever task you are performing. Second, speak calmly and keep your words to a minimum. During overload, the brain cannot process complex instructions. Use short, simple sentences. Third, offer the patient space. If they are safe, step back and give them room to recover without the pressure of your physical proximity. Finally, always report persistent or severe reactions to the nurse. It is essential that the nursing team knows when a patient is struggling, so the care plan can be adjusted to better support them. Caring for a patient with autism requires a high level of empathy, observation, and patience. By recognizing sensory triggers, creating a calm environment, respecting personal space, and providing the right support, you make the healthcare experience safer and more dignified for your patients. Your role as a CNA is vital in helping these individuals navigate a world that can often feel overwhelming. Thank you for your dedication to patient-centered care.